Whereas I, Greg Abbott, Governor of Texas, issued a disaster proclamation on March 13, 2020, certifying under Section 418.014 of the Texas Government Code that the novel coronavirus, COVID-19, poses an imminent threat of disaster for all counties in the state of Texas, and whereas, in each subsequent month, effective through today, I have renewed the disaster declaration for all Texas counties, and whereas, I have issued executive orders and suspensions of Texas laws in response to COVID-19 aimed at protecting the health and safety of Texans and ensuring an effective response to this disaster, and whereas, I issued Executive Order GA08 on March 19, 2020, mandating certain social distancing restrictions for Texans in accordance with guidelines promulgated by President Donald J. Trump and the Centers for Disease Control and Prevention, and whereas, I issued Executive Order GA14 on March 31, 2020, expanding the social distancing restrictions for Texans based on guidance from health experts and the President, and whereas, I subsequently issued Executive Orders GA16, GA18, GA21, GA23, and GA26 from April through early June 2020, aiming to achieve the least restrictive means of combating the threat to public health by continuing certain social distancing restrictions while implementing a safe strategic plan to reopen Texas, and whereas, as Texas reopens in the midst of COVID-19, increased spread is to be expected, and the key to controlling the spread and keeping Texas residents safe is for all Texans to consistently follow good hygiene and social distancing practices, especially those set forth in the minimum standard health protocols from the Texas Department of State Health Services, and whereas, in June 2020, Texas experienced substantial increases in COVID-19 cases and hospitalizations, necessitating targeted and temporary adjustments to the reopening plan to achieve the least restrictive means for reducing the growing spread of COVID-19 and the resulting imminent threat to public health, and to avoid a need for more extreme measures, and whereas, I therefore issued Executive Orders GA28 and GA29 in late June and early July 2020 respectively, and amended Executive Order GA28 by proclamation on July 2, 2020, and whereas, due to improved medical treatments for COVID-19 patients, substantial increases in testing, abundant supplies of personal protective equipment, and Texans' adherence to safe practices like social distancing, hand sanitizing, and use of face coverings, the spread of COVID-19 and the number of new COVID-19 cases and hospitalizations have steadily and significantly declined since late July, and Whereas, I therefore issued Executive Orders GA30 and GA31 on September 17, 2020, allowing additional reopening and non-essential medical surgeries and procedures in Texas, except in some areas with high hospitalizations as defined in those orders, and whereas, as Texas continues to reopen, everyone must act safely, and to that end, this executive order and prior executive orders provide that all persons should follow the health protocols from DSHS, which whenever achieved will mean compliance with the minimum standards for safely reopening, but which should not be used to fault those who act in good faith, but can only substantially comply with the standards in light of scarce resources and other extenuating COVID-19 circumstances, and whereas, in the Texas Disaster Act of 1975, the legislature charged the governor with the responsibility for meeting the dangers to the state and people presented by disasters, under Section 418.011 of the Texas Government Code, and expressly granted the governor broad authority to fulfill that responsibility, and whereas, under Section 418.012, the governor may issue executive orders having the force and effect of law, and whereas, failure to comply with any executive order issued during the COVID-19 disaster is an offense punishable under Section 418.173 by a fine not to exceed $1,000 and may be subject to regulatory enforcement. Now therefore, I, Greg Abbott, Governor of Texas, by virtue of the power and authority vested in me by the Constitution and laws of the State of Texas, and in accordance with guidance from the Commissioner of the Texas Department of State Health Services, Dr. John Hellerstedt, other medical advisors, the White House, and the CDC, do hereby order the following on a statewide basis effective at 12:01 a.m. on October 14, 2020. Every business establishment in Texas shall operate at no more than 75% of the total listed occupancy of the establishment, provided, however, that 1. There is no occupancy limit for the following: A. Any services listed by the U.S. Department of Homeland Security's Cybersecurity and Infrastructure Security Agency in its Guidance on the Essential Critical Infrastructure Workforce, version 4.0, or any subsequent version. B. Religious services, including those conducted in churches, congregations, and houses of worship. C. Local government operations, including county and municipal governmental operations relating to licensing, including marriage licenses, permitting, recordation, and document filing services as determined by the local government. D. Child care services. E. Youth camps, including but not limited to those defined as such under Chapter 141 of the Texas Health and Safety Code, and including all summer camps and other daytime and overnight camps for youths. F. Recreational sports programs for youths and adults. G. Any public or private schools and any public or private institutions of higher education not already covered above. H. Drive-in concerts, movies, or similar events under guidelines that facilitate appropriate social distancing, that generally require spectators to remain in their vehicles, and that minimize in-person contact between people who are not in the same household or vehicle. And I. The following establishments that operate with at least 6 feet of social distancing between workstations: cosmetology salons, hair salons, barbershops, nail salons and shops, and other establishments where licensed cosmetologists or barbers practice their trade. Massage establishments and other facilities where licensed massage therapists or other persons licensed or otherwise authorized to practice under Chapter 455 of the Texas Occupations Code practice their trade. And other personal care and beauty services such as tanning salons, tattoo studios, piercing studios, hair removal services, and hair loss treatment and growth services. Two, in areas with high hospitalizations as defined below, any business establishment that otherwise would have a 75% occupancy or operating limit may operate at up to only 50%. This paragraph does not apply, however, to business establishments located in a county that has filed with DSHS and is in compliance with the requisite attestation form promulgated by DSHS regarding minimal cases of COVID-19. Areas with high hospitalizations means any trauma service area that has had 7 consecutive days in which the number of COVID-19 hospitalized patients as a percentage of total hospital capacity exceeds 15%. Until such time as the trauma service area has 7 consecutive days in which the number of COVID-19 hospitalized patients as a percentage of total hospital capacity is 15% or less. A current list of areas with high hospitalizations will be maintained at www.dshs.texas.gov/GA3031. 3. Except as provided below by paragraph number 5, there is no occupancy limit for outdoor areas, events, and establishments, with the exception of the following outdoor areas, events, or establishments that may operate at no more than 75 or 50% as applicable of the normal operating limits as determined by the owner. A. Amusement parks. B. Water parks. C. Swimming pools. D. Museums and libraries. And E. Zoos, aquariums, natural caverns, and similar facilities. Four, all indoor and outdoor professional, collegiate, and similar sporting events, including rodeos and equestrian events, shall remain limited to 50% of the normal operating limits as determined by the owner. Five, for any outdoor gathering in excess of 10 people, including rafting, tubing, and related services, other than those set forth above in paragraph numbers 1, 3, or 4, the gathering is prohibited unless the mayor of the city in which the gathering is held, or the county judge, in the case of a gathering in an unincorporated area, approves of the gathering, and such approval can be made subject to certain conditions or restrictions not inconsistent with this executive order. Six, restaurants that have less than 51% of their gross receipts from the sale of alcoholic beverages and whose customers eat or drink only while seated may offer dine-in services. 7. Bars or similar establishments that hold a permit from the Texas Alcoholic Beverage Commission and are not restaurants as defined above in paragraph number 6 may offer on-premises services only as described by this paragraph. A bar or similar establishment may offer on-premises services at up to 50% of the total listed occupancy of the establishment if A. The bar or similar establishment is not in an area with high hospitalizations as defined above, and the county judge of the county in which the bar or similar establishment is located files the requisite form with TABC, or B. The bar or similar establishment is in an area with high hospitalizations as defined above, but is located in a county that has filed with DSHS and is in compliance with the requisite attestation form promulgated by DSHS regarding minimal cases of COVID-19. And the county judge of the county in which the bar or similar establishment is located also files the requisite form with TABC. Patrons at bars or similar establishments operating under this paragraph may eat or drink only while seated, except that in an establishment that holds a permit from TABC as a brewer, distiller, rectifier, or winery. Customers may sample beverages while standing so long as they are in a group of 6 people or fewer and there is at least 6 feet of social distancing or engineering controls such as partitions between groups. Where applicable, this 50% occupancy limit applies only indoors. The limit does not apply to outdoor areas, events, or establishments, although social distancing and other protocols must be followed. People shall not visit bars or similar establishments that are located in counties not included in Parts A or B above. A current list of all counties reopening under this paragraph will be maintained on TABC's website. The use by bars or similar establishments of drive-through, pickup, or delivery options for food and drinks remains allowed to the extent authorized by TABC. Eight, for purposes of this executive order, facilities with retractable roofs are considered indoor facilities whether the roof is opened or closed. 9. Staff members are not included in determining operating levels except for manufacturing services and office workers. 10. Except as provided in this executive order or in the minimum standard health protocols recommended by DSHS, found at www.dshs.texas.gov/coronavirus. People shall not be in groups larger than 10 and shall maintain 6 feet of social distancing from those not in their group. (11) People over the age of 65 are strongly encouraged to stay at home as much as possible to maintain appropriate distance from any member of the household who has been out of the residence in the previous 14 days. And, if leaving the home, to implement social distancing and to practice good hygiene, environmental cleanliness, and sanitation. 12. In providing or obtaining services, every person, including individuals, businesses, and other legal entities, should use good faith efforts and available resources to follow the minimum standard health protocols recommended by DSHS. 13. Nothing in this executive order or the DSHS minimum standards precludes requiring a customer to follow additional hygiene measures when obtaining services. 14. People may visit nursing homes, state-supported living centers, assisted living facilities, or long-term care facilities as determined through guidance from the Texas Health and Human Services Commission. Nursing homes, state-supported living centers, assisted living facilities, and long-term care facilities should follow infection control policies and practices set forth by HHSC, including minimizing the movement of staff between facilities whenever possible. (15) Public schools may operate as provided by and under the minimum standard health protocols found in guidance issued by the Texas Education Agency. Private schools and institutions of higher education are encouraged to establish similar standards. Notwithstanding anything herein to the contrary, the Governor may by proclamation add to the list of establishments or venues that people shall not visit. This executive order shall supersede any conflicting order issued by local officials in response to the COVID-19 disaster, but only to the extent that such a local order restricts services allowed by this executive order, allows gatherings prohibited by this executive order, or expands the list or scope of services as set forth in this executive order. Pursuant to Section 418.016A of the Texas Government Code, I hereby suspend Sections 418.1015B and 418.108 of the Texas Government Code, Chapter 81, Subchapter E of the Texas Health and Safety Code, and any other relevant statutes, to the extent necessary to ensure that local officials do not impose restrictions in response to the COVID-19 disaster that are inconsistent with this executive order, provided that local officials may enforce this executive order as well as local restrictions that are consistent with this executive order. All existing state executive orders relating to COVID-19 are amended to eliminate confinement in jail as an available penalty for violating the executive order. To the extent any order issued by local officials in response to the COVID-19 disaster would allow confinement in jail as an available penalty for violating a COVID-19 related order, that order allowing confinement in jail is superseded. And I hereby suspend all relevant laws to the extent necessary to ensure that local officials do not confine people in jail for violating any executive order or local order issued in response to the COVID-19 disaster. This executive order supersedes Executive Order GA30, but does not supersede Executive Orders GA10, GA13, GA17, GA24, GA25, GA29, or GA31. This executive order shall remain in effect and in full force unless it is modified, amended, rescinded, or superseded by the Governor. This executive order may also be amended by proclamation of the Governor. Given under my hand, this the 7th day of October 2020. Governor Greg Abbott.